Our mission is to bring one Iteracare per household, bringing hope to every home. There are a lot of people that have issues they don't even know where to turn to. There are a lot of people that have emergencies, and before they get to the hospital, the person is gone. So this device is something that everyone should have in their house for first aid, because you never know. It can turn things around. I hope we'll have some people to share testimonies, and I'll also share some of mine. But this device is really, really amazing. Like I shared in the past, there was someone that had sickle cell. In fact, from what I even heard, I just heard the full story. The person was sent home from school, and has been in crisis for over 2 weeks. They couldn't handle, and they had to send the lady home. And her mom, who is a nurse, was treating her for over 2 days without anything, giving all the analgesic, nothing happened. And when they brought her here, within 15 minutes of blowing the Itera, the lady slept off. This is someone that has not even slept for over 2 days, because the pain was gone. By the time she woke up, the pain was gone. Like someone will say, the sickle cell crisis is even worse than labor pain. So you can imagine, how you can help people. There was another elderly man that is about 89, came to Lagos with a walking stick, and then he was supposed to go like 2 or 3 days later. And then by the time we did the ITER on him, in fact, the man was so happy that I said, come, it seems he's going to postpone his trip. So we were able to do like 5 sessions on him. And by the time he was leaving, after that 5 sessions, he has thrown his walking stick away. And he went back to the village, and when he came back in 3 months' time, he was looking really young. And in fact, he was not with his walking stick. And he was so happy, So that's the power of the ITERA, changing lives, helping our elderly, helping people that otherwise you could not even do anything for. Asthma, we've had some cases that I was speaking to a client of mine, because her daughter normally fall ill because of stress of work and everything. And she's also asthmatic. Right. For the past, I just said, look, use the Iteracare on the person. Use the Iteracare. And for the past 6 months, 8 months, no crisis, no asthma, the stress. She's able to cope better. She's not falling ill again. So that's the power. It can really, really help. You see a case of goiter that we had, and we're blowing, and within few days, the lump has really, really reduced. Unfortunately, with a lot of our people, they don't want to stay on camera and then, share their testimony, but God will help us. I tell, okay, if you cannot share, then send it through your WhatsApp. Let us have something that, because when you share with people, people get encouraged. A lot of people that have these similar things, they are encouraged, and they know that, look, all hope is not lost. So it's very, very important that we try to help. ITERA is about helping people. Don't let them fall into the hands of all these fraudsters. Help them, and we need to also spread this message that, look, help is very, very near to you, and it can do a lot of things. We've been able to help a lot of people from amputating their legs, using this device. So I want to thank everyone, and I'll open the floor for testimonies if there is any. Please, you get back to the person that invited you. So can we have testimonies now, if there's anyone that want to share? Okay, Dr. Adolphus, I see you've unmuted yourself.
Good evening, everybody.
Good evening, sir.
My name is Dr. Daniels. I'm based here in Kaduna. I just want to testify about the Iteracare has affected some sickle cell disease conditions with 2 patients. One is an undergraduate in a university, and before he came to us, he's been having crisis almost every month that warranted his admission in the hospital. So he was a regular visitor to the hospital because of the crisis. About 4 months ago, the guy got the Iteracare, and we told him what to do, especially the water and blow himself. And up to today, after 4 months, he has never had a single crisis. Even when he had malaria and typhoid, the doctors were surprised that he didn't have crisis. And that is the beauty of Iteracare. The second one is a 19-year-old girl, and that is, I think she came in about 4 weeks ago. During the rainy season, that's when she has a crisis. And for the past four weeks now that she has been with us, she has been enjoying good health, no more pains. And the mother was so happy. They came today and they were very, very happy. In fact, when she came, she was limping on one side of her body, so her walking gait was distorted. But now the girl can even run, no more pains, and she's walking like a lady. So that is one of the beauties of Iteracare. Thank you very much.
Thank you very much, sir, for sharing. We appreciate your sharing. Thank you.
I have a question. This Iteracare, can it be used for keloids?
I'm sure yes, but it will take some time because of the fibrosis already there. But it will help it to become softer and softer, and gradually the scars will start, fading. So yes.
I think I once showed a picture of keloid I use it on. That's for keloid from cesarean section in some of my previous presentation. So the itching on the keloid disappear within a week. Within a week, the keloids around the incision side, melted. So I'm very sure for small fibroid, keloid, you can get rid of it within a few weeks. For bigger one, you might need to use it for months.
Thank you very much, Dr. Akinkoye.
Thank you very much, sir.
So I think let me just add this testimony still on cerebral palsy. I have a child that, a child of about 5 to 6 months who was not able to move, use sign language. So I said, okay, no problem, let me go 1 month free. And they were coming twice daily. Now the boy can hear sound, but he's still not able to talk, but he can hear sound. Even when you are behind him talking, he will move to let you know that he's hearing you. So that's the amazing work of Itera. And I'm sure by the time they still go ahead with it, they're still on the treatment, and then further improvement will come, because he wasn't born deaf and dumb, but all of a sudden he developed that. So, but now he can hear. So thank you. That's all.
Thank you very much, sir. Ade John, I can see your hands up. Please go ahead.
Good evening, Dr. Faith. Thank you very much for the training, and it's been impactful. So my testimony will be, I'm Erelu Dr. Mujishola Ade John. My testimony is that yesterday I was up this morning. When I woke up, I decided to check my BP, and it was 167/120. I had a meeting in the morning, so I had to postpone it, because with that kind of BP, I can't go out. So I started myself on some medications. It wasn't going down. The best I could get was around 150/110, which is still not good for me. So I remember my Iteracare and I got it out and I just put it on the acupoints, I noticed I was having some pains around my kidney area. So, I put it on the acupoints for the kidney, and then, run it on all of my body, and, to the glory of God. And then thanks to Iteracare, later in the day around 2 p.m., I checked it again, and the blood pressure had come to 110/82.
Hallelujah.
So, so I was able to calm down, because, when you start having, I had some health challenges, so my BP should not go up.
Yes.
So, I was able to calm it down, and, checking it since morning, it's been okay, and I rested. So I just want to testify to the work of Iteracare. Thank you
very much, ma. Thank you very much for sharing.
All right.
Thank you very much for sharing. There's another pharmacist that shared with me about her father who had a hypertensive crisis. It was like 200/1 crazy value. And she was just panicking and not knowing what to do. She now remembered the Itera and then went and quickly blew him. And then by the time she now rechecked in the next 1 hour, it had come down to about 140 over something. So, the problem is we're not even consistent. Sometimes it was when there's a crisis, we now remember our device. But thank God it's there that we can now use and then see the effect. So thank you very much, Ma, for sharing. Thank you. We appreciate you. Thank you.
Thank you very much.
Yes, Ma. Is there any other one that wants to share? Is there any questions?
Doctor, can you hear me?
I can hear you because you muted yourself.
Yeah, because I have a testimony. Because
Yes, ma'am.
I don't know how to really handle this Zoom. Good evening, doctor.
Good evening, ma.
Yeah, I'm always, I always gain a lot.
Yeah.
Each time you and Dr. Akikoe make your presentation. If you can remember, maybe about 2 weeks ago, I sent a note to you that I have pains all over. It's like I have inflammation, pains in my joints. I was treating fever and fever and fever again from 3 hospitals. So I suddenly woke up that this device is still in my house. I have it. I sent a message to Dr. Akikoye to ask whether I could use it, and then you gave me your reply, and I started using it. Honestly speaking, the pain went to, because I had similar problem 2011. I know what I went through in lawsuit. The pain went because I was actually hitting my head, my neck, all the joints, and I noticed some swollen parts, inflammation in the joint. By the time I did it consecutively four times or so, the pain went away, doctor.
Hallelujah.
So
Like I said, we are not consistent with our device. When something happens,
I'm not. I in particular, I don't know
will
what
not
I have.
remember that.
It's only when there is any
There's
problem.
something there. But we thank
And
God.
I've not even touched the device for months now. I don't know. It was when this one came up, I said, this device is supposed to be able to do something now.
Yeah. We thank God for that testimony.
Please, I want to ask this question.
Yes,
Hemorrhage that has burst out.
yes.
How can we use this device to actually handle it?
You can treat it, but you use the low. It's better you use the low,
Okay,
the mode
directly
2.
on the budging, Abi?
You said? Yes. Use it directly on the budging. Use a low heat, mode 2.
Okay.
Use a low heat, and then you can also use the mode 1, but you move back a bit.
Okay.
It helps. It really helps. A lot of people have given testimony about the hemorrhoids.
Okay.
Then let the person change their diet, fiber, more fiber, stop food. So lifestyle is very important.
The person is trying, it's just more of an inherited something, but then
No. It can be dealt with. I tell people, your gene could have loaded the gun, but it's your lifestyle that pulls the trigger.
It's a fact.
Yeah. So please do that.
Dr. Faith, and thank you, Dr. Akitoye.
Okay, welcome. Thank you for sharing. What's now this phone? Y9S. Please go ahead. I can't even pronounce the phone.
It's Menima from Jaws. Good evening, house.
Good evening, sir. Thank God your network is okay now. How are you?
Yeah.
Yeah, go ahead.
We thank God. How's the family? Good. I have a testimony of one man who has stroke. Before the treatment, really, he didn't come to see me. He came to see somebody else in a compound. So I invited him to give him a shot of some minutes.
Yeah.
And I asked him whether he could come for 2 sessions a day. He said, yeah, he's able to do that. So we arranged by 2. And before that time, his arm that had the issue, he cannot lie on it. There will be so much pain. Instead of 2, it was around 3:30 to 4 before he came back, because he went and slept on that hand, there was no pain. So he came back for the second day time. Now he's, I would say he's a disciple of Iteracare, telling other people to come to the center. Something good is happening there.
Wow.
Yes. Thank you
For that testimony. Like I always say,
yes,
we are there to touch lives. We are there to help people. A lot of people have these issues. They don't even know where to go to. They don't know where to go to.
Exactly.
Yeah. So it's a very simple device, but that terahertz does a whole lot. It does a whole lot.
Yeah.
And it's almost magical. Let me use that word. It's almost magical.
Yeah.
Please, tell everybody that needs it. Tell everybody that, have a practice, because you can really touch lives using it. You can really touch life. There's a
Sure.
doctor that came with his wife. The wife is a lab scientist, and I think maybe the bending or microscope and everything. She's been having cervical issues and then lumbar issues. She had a surgery a few years ago, which even the surgery itself, was not exactly, in quotes, very successful. She's still having that back pain, and they now told her to come for another surgery for the neck. She was like, no. She spoke to some few people, including me, and I said, look, I don't advise you for that because it's a 50% chance. Okay, come and try the Iteracare. She's been on a lot of medications, no significant improvement. I said, look, there's something I think can help you. Come and try the Iteracare. We can also add something called prolozone, to fasten the whole process. But before we start prolozone, come and try the Iteracare. And then I told her, because her distance is a bit far, I said, at least come 3 times in a week, but she was not able to meet up. She may just do once a week. I said, no. Once a week is not going to do much. So I had to give her, that was last week, I had to give her a device. I said, okay, fine, give her a device, take home, go and use it 3 times a day, at least for 7 days, and then come back and give me a feedback. And it's really, really amazing. She was here last week, Wednesday. She said, even her neck collar that she has been carrying, she said, this is my friend. I have dissociated myself, with the neck collar. She's really amazed. She's much better. And if you see her, she's looking much younger. And it's really amazing. It's really amazing. It's really amazing. So it's a worthwhile device. It's something that we should really add to our therapies. Is going to make every other thing, work magically, and we can also help people and save life. A lot of people are in pains, without really knowing where to turn to. And taking an analgesic, we know the side effects involved. So please let us spread this good news that, look, something there is hope for you. You can get out of this situation, and I'm sure we'll be blessed in return. Thank you, sir. Dr. Royal, do you want to share? I can see you have unmuted yourself. You shared with me a very beautiful testimony.
I'd love to share something brief out of multiple experiences. There's this amazing one that has been trailing me for a while. A colleague, invited me to take care of her mom, who just developed a stroke 36 hours before invitation. And so we started the sessions, okay? And what I noticed was by the second session, she already started feeling pain on the affected limb, okay? So pain started. Initially, there was no sensation, but by the second session, there was pain. And then we continued daily. It was a daily session, okay? By the third day, the third session, okay, she was already having better control of the muscle, the chewing muscles. So the drooling was reducing and all. Then by the fourth session, we also had more improvement. She was able to sit better. The other limb that was okay was not as strong as before, but became stronger. So she was getting better. She was able to even smile. And the fifth, but something amazing happened by the sixth session. This time around, the sixth session, suddenly the device was at I think the highest. So she suddenly moved her leg, this limb, and I said, it's like this limb is moving. She said, yes, that it was hot. Hallucinating. We've not seen someone having stroke, just recovering in less than barely a week. So it was amazing. And then we went over to the other limb that was okay. And while doing the therapy, she now moved the knee this time around of the affected limb. I said, she's obviously moving this limb. And so we now told her, Mama, move your leg. And she moved it again consciously. So in sixth session, the limb was moving, but the arm was not yet moving. So we know she's supposed to have gone through 10 sessions. So we are very hopeful that before the 10th session, everywhere would have fully recovered. So I just want to share that with you.
Thank you very much, sir. That's amazing. I'm sure Dr. Daniel also had a lot of stroke cases that, within few days, even he was shocked at their kind of recovery. And there's another person that also shared similar. This person had even had stroke for like, I think 5 to 10 years, thereabouts. I can't remember exactly. I shared on the platform. And just like 2 sessions, the mama was already moving. If everybody was just in shock. So it's really amazing. Like I said, for cases that otherwise would have just been there, pathetic, restoring hope onto them. So it's really, really amazing. Thank you very much for sharing. And just like I shared on the platform, I don't know if my friend is here, of her mom that fell down. Mrs. Abiola, are you here? Do you want to share with us, or should I go ahead? Let me check if she's still here. She called me late last night. I think, I'm not even sure, maybe around 10:30, 11. I don't know if she's here. Around 10 thereabout, that her mom fell and they hit her head on the wall, and that place was swollen. So she applied ice, and she was now wondering if she could use the blower, the Itera. So I just sent a message. I said, please use that Itera immediately, blow that particular swollen area for 20 minutes, go to the other areas and blow the rest of her body. And then we're just communicating. And then I was like, is she stable? Is she stable and everything? And I just told her, okay, let's do that. And then, she now did that. So I think it was around past 11 p.m. I had to go and sleep. And this morning I will just send her a message that, how are you, ma? How is she doing? She was like, wow, that the swelling practically disappeared, as if magical, right? As she was looking at it, that place was swollen and tender. And then right under her, under her nose, that the swelling was just reducing and reducing. That by this morning, the swelling was gone. And that even the back that she hit, that mama was complaining about, the back pain was gone. The ankle that was also swollen, the ankle is gone. And she was like, wow. So this thing, she's had it for over a year, but she's not even convinced that this thing really works. But today, she's sure that truly, this device works. And then she also has some issues she's dealing with. She doesn't have sensation on her feet. She was just sharing that with me today. She has some autoimmune issues that affected, her nerves, and the disease process causes a lot of fibrous tissue. So she doesn't have sensation on her legs. That since that few days now, she's been using it, trying to use the device consistently, that she found out that, she stepped on something and she felt sensation under her feet. It was like, is it just her mind playing tricks on her, or is she really feeling something? And then she now applied her hand to that place and now discovered that she actually felt it. So which means her sensation is actually coming back. So she was really, really happy, and she had to share with me, this morning. So I just said, let me share. So like I said, no matter what the issue is, no matter what the challenge or the name of the problem is, use the Itera on that thing. It may not take one day, it may not take 1 week, but the truth is, even baby steps, the body starts to recover. For usually things like autoimmune, all these vitiligo, psoriasis, it can take 5 months, 6 months. But you see, once you are doing it consistently, the body is very intelligent. It can always look for a way to heal itself. So please, we need to share this good news. People that have not experienced it, please invite them and help them, because a lot of people have issues they don't even know where to turn to. So thank you very much for joining this evening. And if I don't know if there's any other question or query, we can call it a night. Thank you. I appreciate you all. God bless you. Have a blessed Sunday.